at the end?
No, I just will put it. So we're going to be performing some additional tests for the shoulder. So for this, I'm having the athlete lay off the table, or in this case, my bed, to work through some special tests involved with ruling out shoulder dislocations. So firstly, I'm going to perform the crank test, or otherwise known as the anterior dislocation apprehension test. So for this, you have the athlete lying with their arm abducted to 90, and then we're going to bend her arm to 90 here. And we are essentially going to push her arm back as far as we can without, And essentially a positive would be any apprehension on the athlete's face. If they have a prior dislocation, they would know that this is a vulnerable state and they would feel instability and potentially fight back. So they basically push against your resistance here, stopping it from going into that vulnerable state. The next one we're going to do is the posterior apprehension test. So if this one is the anterior test for anterior dislocations, the other will test for posterior. So for this, we're going to have the athlete cross-flex their arm at about 90 degrees, having their arm there. We're going to put our one hand underneath the shoulder to feel for any movement or activation of shoulder muscles of the rotator cuff. And what we're essentially going to do is we're going to push. Watch your elbow. Okay, I'm not applying the pressure in the right spot if your elbow's going down. You want to essentially push their shoulder down into the table, and they would essentially become apprehensive at this because it would replicate the mechanism of injury for a posterior dislocation. So as you begin to do this, they would essentially show fear on their face, and you would stop, or they'd ask you to stop, or they would guard, which essentially they would tense up their muscles to stabilize, and that would indicate they've had a posterior dislocation or have posterior instability in their shoulder. So, yeah, those are the tests.